Welcome to Scan's Career Corner, co-sponsored by the Greater Long Branch Chamber of Commerce. You may remember a show that we put on with Michael Sirianni about the Culinary Arts School in Monmouth County. Well, today we're going to have the opposite show. We're going to talk about a nutritionist who tries to get that weight off. Stephanie Leonetti is a nutritionist, and she's going to talk about a career in nutritionism, I guess. She's from Pop Weight Loss, and just welcome to Scan.
Thank you. Thank you for having me.
Okay. Stephanie, what is a nutritionist, by the way?
So you could go different ways with this, but a nutritionist, I think a lot of people right away think she is focused just on weight loss. But as a nutritionist, you want to teach anyone, any age, any gender, how to just lead a healthy lifestyle through the right foods, the right exercise, and not all this processed food that's out there. So it's just really teaching how to live a very healthy lifestyle the correct way.
So some people may be healthy, but they may be overweight, which I think most Americans, I think all the stats always say that Americans are overweight, and a lot of it has to do with diet and lack of, say, exercise.
Right, and you could be a person that's a healthy weight, but not healthy. You know, and genes do have a factor in it, but you have to have that right combination of the food and the exercise. And you don't want to be a super skinny person. You know, of course you don't want to be overweight because, you know, if you go through the BMI chart and your BMI is obese, then you could develop more medical problems, which we want to try to lessen. So it's not a matter of getting to that number, that weight number, your goal weight. It's just really learning how to just be healthy with being comfortable also, and, you know, just watching what you put into your body. You know, that's what it's about.
Do you have people who have, for example, some dietary issues, diabetes, for example? I think everybody knows someone who's diabetic.
Sure.
And there's a type 1 and type 2. What's the difference?
So and that's another one too, that is where it could run in the family. It could be genetic, it could be overweight. You might not even know you have it sometimes. But one is where, you know, your body's producing the insulin. One has to do with just all the excess fat on your body. But it's your sugar content. So when you go, the best way really to tell is through blood work. And there are some symptoms from it. You could feel lightheaded. You could feel like you're going to get the shakes. But you have to make sure your sugar levels are controlled. So you have to get them under a certain number, and you want to really get it under a 5.6 and then keep it there. But even if it does run in the family, you could reverse it, but you just have that higher chance of having it.
But what is the difference between a type 1 and type 2 diabetes?
One produces, one doesn't.
Oh.
It depends on your body, you know, so, and one of them you might have, and you might not be able to change it.
Oh, so one can be inherited and one can be lifestyle that
Correct.
Creates all that. So does your place get referrals from doctors or medical centers and say, I think what you really need to do is go see a nutritionist to not necessarily, as you said, lose weight, but to have a healthier lifestyle.
Absolutely.
So what do you do? How do you recommend? How do you get to where you are, by the way?
Sure. So I mean, it's important right out of high school to know where you want to go to college, because not all colleges have a nutrition program. And you really should get at least a bachelor's of science in it. So
usually like a human ecology kind of thing, where there's some schools like Cornell used to be home ec, but it really became human ecology. You had a broad range of things.
Right.
So you had nutrition, diet, this, and this.
Right. So and I'm not sure why not all schools have it, but I have that bachelor's of science in nutritional sciences. So that's definitely your first step to get yourself in the door. And then you could go a couple of different ways. You could proceed to get your master's. If you want to be a registered dietitian and go work in a hospital, you have to go through an internship. For myself, I didn't want to work in a hospital. You know, the patients in hospitals don't want your help. They're there for something else and they want to just get out. You know, it's different. So I knew I wanted to work with people to help them lose weight the right way.
So you can develop longer-term relationships. You just described, you see somebody who's sick, they don't even want to see you, they just want to get home as quickly as possible. as opposed to relationships, working with them,
Right.
seeing progress. You yourself feeling good that you helped them get better,
Right,
or
and
get them healthier.
weight loss is personal. You know, it's emotional. You don't know why the person.
I personally like to lose weight. I mean, it's,
and you don't know why that person got to that point. It could have been something that was, you know, a tragedy in their life. You don't know. So you really, and I work one-on-one with my clients. So you get to develop that relationship. I see them once a week until I get them to their goal weight. So you do develop that relationship. So you do have to, in the beginning, where I was saying where you want to go to school and everything, know where you want to go. You have to just plan it a little bit. But there's a good amount of opportunities.
do you foresee that you, as a nutritionist, can grow into a managerial position where you have a number of nutritionists at different sites that you
Definitely.
have to watch and all? Now, let me ask you this. What about all these things like Weight Watchers or those bars that say you're instantly going to lose weight if you don't eat it or drink it at the bar? I mean, do they work? To me, it seems like they're always fads, and they really don't work.
Right, and you're going to always have those fads. That they're never going to go anywhere, unfortunately, only because I don't believe that they work. Because let's say you did just a bar and shake program, so that's all you ate, bars and shakes all day. Sure,
When you dance, you shake, right?
Right.
Okay.
And if you do that, sure, you're going to lose weight. You're taking in so many less calories that your body needs. It's not the healthy way, but you can't live that way forever. So when you stop the bars and the shakes and you go back to regular food, it comes back. So my goal with clients is not to just teach them how to lose the weight, but to keep it off.
Many years ago, when I was working at J.P. Morgan and gave blood, I was going to law school at night, gave blood, and they said I had high cholesterol, and I was 27 at the time. And so they said, well, before we could give you a diet, you have to write down everything you're going to eat over the next several days. Well, it was Thanksgiving weekend, so it wasn't very good in terms of what I had to eat, what I had to drink, and so. But after they reviewed all that, and my wife decided to join me on a low-fat diet, I did drop 35 pounds. Of course, it doesn't look like it because it all came back, and so what I'm leading to is some people like myself may have a dramatic weight loss over a short period of time, say 3 months or 3.5 months, and then it just creeps back and sometimes goes over. How do you prevent that? Is weight loss that quick no good?
Right. So I don't recommend it that way because usually what happens is you lose it quickly, you gain it back just as quick. I like to keep everyone within a nice 2 to 3 pounds a week steady. You might have those weeks where it's less or more, and that's great, but every week, for example, when I meet with my clients, I review everything with them, and I'll figure out why you lost that amount that week, and then we're going to try to keep to it. But I don't restrict people with going out to eat. I don't restrict people and say you can't have any alcohol because it's not realistic. You know,
Wine's supposed to be really good for your
red
blood
wine
pressure.
it is. It's good. It's great for you. And so something like that, I don't take away. So I try to teach everyone that realistically, don't make it all about the number. That's what everyone does.
So when they say 2 glasses, does they mean 1 glass bottle and the other glass bottle, or just 2 small glasses?
Depends on the day. No, but I say 4 ounces is good.
Okay. But it is something that you would recommend to some people who can do that.
Sure.
That's all part of the regimen of having a healthy
all
diet.
about the lifestyle.
I mean, I know somebody that you probably know too, and she only does wine on weekends with her husband, and then that's why she WHINES wines during the week. Because she can't unwind. But in any event, so you find it to be a rewarding career
Absolutely. It's a feel-good job.
because you see success. I'm sure there must be times when people just aren't sticking to it, but they have other things that are causing that,
Right.
like problems at home, problems
Of
at
course.
work, financial problems, and then how do you try to work with them when other things are preventing them from having it work?
So when they see me and they, like I said, I develop that relationship, so they're very open with me. They'll really be honest. I just try to keep them positive about going through those times and just maintaining it. Don't look at it as focus on losing weight that week, because there might be other things that are going to come first, because you don't know everyone's situation. But the biggest thing with that is positivity. I have to just keep them positive and motivated. If I could do that, they'll at least be able to maintain. And I push exercise for that, for helping with the stress level. That's one thing.
So in some cases, not gaining any weight is a success. So
Yeah.
they're just not bloating themselves, but rather just keeping it on an even
Right. You
keel.
just have to keep them motivated and know that if, let's say, they even came to you and gained one week, they're not looking at like they're a disappointment to you.
So what about the exercise component? What do you recommend in that area?
So I try to get everyone to do at least 30 minutes a day. It could be as simple as walking, but
How about talking?
and walking together would be a good combination.
Okay.
But that's what I try to do. And even if you're not looking to lose weight, especially with women and all the heart disease out there, exercise is key for just health.
You mean just by running around the office isn't good enough? You really should get out in the open and
You wanna be
on
sweating.
a windy, on a day like today, where it's raining and pouring and windy and everything else. So what do you do when you're not being a nutritionist?
So on the side, I'm also a dance instructor. So
Oh, so that's exercise too,
Yeah.
isn't it?
that's what led me into my career. 'Cause-
Which career? Dancing or nutrition? Really? How?
Well, I grew up competitive my whole life, and
Rumor has it you were at a Super Bowl once.
Orange Bowl, but
Orange
I
Bowl?
was.
All
yes.
right. In Miami?
Miami. Mm-hmm.
What year was that?
2007.
Who won the game? Who played and who won the game?
Only-
See, only the dance.
I remember one team was in it.
Okay, but
And
usually
I
football
don't-
has two playing.
Yeah, that's
but
all I can
do you remember
remember.
which one?
No, but Virginia played in it.
Oh, okay. Look it up in the record books. So tell us about that. How did you get there?
So from the dance studio, we were invited because we are on competition teams. So going through all the competition, your name gets out there, and we were invited, and we went to Miami for a week, and then we performed with ZZ Top.
Really? Mm-hmm. They're still around?
They were then.
They were then.
But yeah, that's what I like to do, and I teach it to the kids, and I kind of at the same time put it together. I make sure they're having fun with the dancing, and I try to tell them to eat healthy too, because it's going to get them to be a better dancer.
Now, when you did it at the Orange Bowl, you didn't eat before time, did you?
Well, it was a night game, so we
Oh,
that one we
you would've
had
been starving.
to, and we were like running all over the field on that.
Exciting.
It was fun.
Would you want to do that again?
Absolutely.
Really?
We were on TV, so it was pretty cool.
I heard Dallas was looking for some cheerleaders, or is it the Giants? We have a little bit more time left. Can you name a few schools if people wanted to, in our general area or even throughout the country, schools that they could go to that have the nutrition programs? I know, for example,
Sure.
Cornell does in New York, but what other schools
Sure.
have it,
So
do you know?
Rutgers is one. That's where I went. So
Okay.
that has one, and another one in New Jersey is Montclair.
Okay.
Those, I believe, are really the only two with 4-year degrees in New Jersey.
In New Jersey itself?
Even like, I know Brookdale, from the last that I know, they have a nutrition course, but I don't know that they have anything more than that. I do believe New York has some more schools.
Yeah, well, because obviously it's a bigger state.
Yeah.
And plus, you have a commitment by the land-grant colleges, the agricultural, where they can really push and expand. And I believe the human ecology is also a state school. Well, Stephanie, thank you very much. I think we all learned something today.
Thank you.
Take it from me. Living with a chronic disease is no easy task, but I learned to better manage my health condition, and you can too. Take Control of Your Health is the chronic disease self-management program created by Stanford University. This fun, innovative course is now offered to all county residents. Diabetes, arthritis, heart disease, cancer. Take Control of Your Health gives proven strategies to manage these conditions and reclaim your life. See how nutrition, exercise, and various mind techniques can help you overcome depression, increase energy, and manage pain. You'll not only get this book when you participate, you'll also receive the guidance and support of others living with a chronic illness, just like you. Take control of your health in 6 short sessions.
Call the number on your screen to register or get further information at scannj.com. Brought to you by SCAN, Social Community Activities Network, with funding made available by the Monmouth County Office on Aging.
Welcome again to Scan's Career Corner, co-sponsored by the Greater Long Branch Chamber of Commerce. We all age, and hopefully we live long enough to age, and I think what is going on in our country today is that we're promoting more and more healthy living. But of course, there are times when we need that insurance because things just happen to us. Today we have our guest is Bob Haggan. Is that pronounced correctly?
Haggan, correct.
Okay. Who's an expert in the Medicare field predominantly. Is that correct?
Well, we're not allowed to say expert.
Oh, okay.
But it's the only
I call him an expert. He doesn't have to call himself an expert.
It's the only insurance product that I work with.
Okay.
I'm not a jack of all trades. For the past 11 years, I've been doing only Medicare for people who are 65 and older, or some people under 65 with disabilities may also qualify.
Okay, let's get back to how you got to where you are.
Well, out of college, way long ago, I started working with a fellow who was selling printing and promotional products. We were very close. He was my mentor. We opened a couple of video stores together while we had that business.
What are they?
Right?
What are video stores?
Well, we got in '86 and got out in '88. So, but after exiting the video business, I had some money and I opened up my own distributorship of selling printing and promotional products. 9/11 came along. Business took a big hit. 2008, it took another hit, and in between 9/11 and 2008, I, got my insurance license. My dad was in a nursing home, and I saw how much that cost, and I, did some research, and I said, I want to help people with long-term care insurance.
Wow.
But then, that was, I wasn't very good at it. Long-term care insurance wasn't inexpensive, and asking somebody in their 70s or 80s for a $5,000 check just didn't, it wasn't for me. So a friend of mine said, what, you should be working for people with Medicare. Some of the plans are zero, or some of the plans are, 20% of the cost of what someone's paying now for regular insurance. You could really help them.
Wow, I do a lot of elder law and work with a lot of elder people, so this is something that my compatriots, my compadres would certainly be a lot interested in, because we get these questions all the time and really don't know where to seek out someone like yourself. How did you learn about all this stuff? It seems to be almost mind-boggling, some of the rules and regulations and when you could do this, when you can't do that, and maybe we could start with, when does Medicare kick in?
Okay, so Medicare basically kicks in at 65 and older, or under 65 if you have a disability. So when you turn 65 years ago, I've been doing this for 11 years, most people had Medicare Part A and Part B when they turned 65.
One's doctors, one's hospitals, right?
Right, and you get your Medicare Part A automatically when you turn 65 because you've been paying in your paycheck for your Medicare Part A. But on the card it says, if you do not want Part B, just sign this and send it back.
Well, if you have someone in your family who has good coverage for both of you, you don't need B yet. Is that correct?
Correct, if you're still working or if your spouse is working, because when you do take Part B, if you're collecting a Social Security check this year, they're going to be taking out $104.90 out of your Social Security check. So most people, if they're still working and they're covered through their job, they don't elect to take Part B.
So, but this $104, that's regardless of how much Social Security is giving you?
No, it depends. It goes under, for an individual under $85,000 worth of income, it'd be $104.90.
Okay. If
the more money, you could be up to $220 or higher.
Okay, but still getting back to the question, let's assume there was a low wage earner, say lifetime earnings maxed out at say $20,000 or $25,000, and the monthly check is not as great as someone who makes, who may have made $85,000. Is that 104 still applicable to the lower recipient as opposed to a higher recipient?
Correct. Correct.
So it's a flat cost, so it's spread out through the thing. So getting back to that though, how do you learn all this stuff?
Well, I was lucky enough, knowing enough people that I was able to work with United Healthcare through their AARP.
Okay.
So they bring you on and you get a nice training, but I've learned an awful lot by making presentations. 11 years ago I was 47, so I'd be sitting down with people who had Medicare. They knew more about it than I did. So I kept my ears open, learned an awful lot, and study, and we're tested every year, AARP. does a tough screening process, vetting process yearly, and so I learned through that.
When I turned 65 and I had to go through the process, there's a lot of information that's on the screens. Okay, you look it up. And even as an attorney, some of the stuff is written in government Ds, meaning some government guy wrote it, and it's not necessarily what we would call plain language. And a lot of times you're going through it, and you don't know if you're in a catch-22 or whether you're in the right catch or no catch. So someone like yourself is someone that someone could call and say, Bob, help me out with this. Is that
Correct.
pretty much the way it works?
Certain times, United Healthcare, they get phone calls. They'll send it to me, I'll call someone, and they don't want anyone coming to their house.
Right.
Okay, I can understand that, but I only look it through myself, and I just see how much benefit I can give someone. All I do is, Medicare insurance, and, the insurance companies compensate me. So to go out to see you, you don't pay anything more. The insurance is regulated by the state of New Jersey. So if you buy it directly from United Healthcare, Aetna, or Horizon, you're going to pay the exact same rate as if you use someone like myself.
So now you're actually explaining something to me, because again, those people who are going to be turning 65 will probably have the exact same experience. I must have had 7 to 10 mail solicitations from different companies. So that's what you're referring to.
Correct.
The ones that were United are the ones that would be coming from your company as opposed to somebody else's company. Correct. That comes to me.
Now, I do represent every insurance company in the state of New Jersey, okay? Because I think I don't work for the insurance companies. If I was out to see you, I work for you. So, my contract with United Healthcare and AARP is that I present their product. However, if that's not a right fit for you, I can, help you with something else.
I mean, different companies will charge you differently, or
for the exact
what they
same
give you
plan.
covered?
Absolutely, for the exact same plan, like a Medicare supplement. I'm guessing maybe you have F. So if you have Plan F, you don't pay to go to the doctors, you don't pay to go to the hospital, you don't pay for blood work.
But you pay premiums to get that benefit for no copay.
Correct. So now United Healthcare might be $172, Horizon might be $184, et cetera, et cetera. But even more important is the drug coverage. Okay.
Part D now. Is that
Part D.
What's C? Before we get to D,
C
what's
is
C?
a Medicare Advantage plan.
What does that
It's
do?
A, B, and D combined to get C. Okay, so most the Medicare's Advantage
How do you get an A,
plan,
B, and D and make a C?
It's the new math.
I like vitamin C, take it every day. So I try to wards off colds, but go ahead.
Part C is a Medicare Advantage plan. Okay, many people have, 28% of the people who pick insurance are now going for a Medicare Advantage plan. Most of the plans are HMOs. You have to see a doctor in the network, but you're not paying a premium for the plan. Whereas someone with Medicare Supplement Plan F might be paying $170 a month, that's $65, plus another $40 for the drugs, that's $210. A person that has Part C, the Medicare Advantage plan, most cases will not have a monthly premium. Pay zero to see your
what do you mean?
Because if someone joins a Medicare Advantage plan,
Yeah.
instead of when you go to the doctor, you're showing your Medicare card. Doctor's billing Medicare, then the balance goes on to the insurance company.
Right.
If someone has a Medicare Advantage plan, they're showing the company's card, AARP Medicare Complete. They show that to the doctor, and the doctor only bills the insurance company. Because every person that's enrolled in a Medicare Advantage plan, the government pays the insurance company to take care of them.
Well, it's third-party processors is what you're saying,
Well,
basically.
years ago when, President Bush, when they were looking at it and they're saying, listen, the private insurance companies can do a better job than Medicare.
Right.
Okay, because they're looking at the bills a little closer, and we
right.
see how much Medicare fraud there is. So,
Probably more than anybody can imagine.
correct.
I've run across many where there's somehow, and if you recall, Bob, and it wasn't that long ago, sometime I believe last year or earlier this year, where there was a lot of airplay about how some hospitals are the most expensive in the country. They're not necessarily the most expensive. They just bill Medicare as much as they possibly can because they look at it as a negotiating tactic.
Correct.
So what a doctor may get reimbursed for a $1,500 procedure that he bills $50,000 for, and I know I see some of these things, my head swoons. What's the advantage to the hospitals by billing so high. I mean, Medicare's not going to give them the money.
Yeah, that's
just kinda silly.
above my pay grade.
But it just seems insane. And we had a guest not that long ago talk about the HIPAA regulations and enforcement and how there could be a lot of penalties. But I do a lot of estate work, and sometimes we get a bill. This is not a bill. 5 years later,
Right.
and those people are never going to get paid because they were screwed up on what they should have been billing. And so now if the hospital is going broke, it's their own damn fault for not keeping up with accurate billing or coding or everything else that goes with that.
And that's one of the things that I tell my people. My phone number that they have is my cell phone. I don't screen my calls. Today the interview, my phone's off, but I call everybody back, and if I'm not with somebody, I answer my calls because, last year I enrolled 2 men that were 95 years old each. Okay, because everything changes every year. They needed someone. I was in there, and then you don't want to be doing this at age 95. But unfortunately, with all the changes, but I'll go back to the home and look at the bill and say, no, you don't have to pay this. It says this is not a bill.
Right.
But if they get the money, I believe it's probably hard to get it back from them.
Yes. That's why I say you pay nothing until you have to pay something. And a lot of people just got to get that bill off their desk and they sign it up. And then I say, oops, you should have done that because now you may not ever see that money again. So at what age would you start talking to people about this, about the Medicare coverage?
Well, before you turn 65, you really should get a hold of Social Security. If you're still working, you let them know, your A is going to start, but you might want to wait on your Part B, or you want your Part B to start. And then once your Part B starts, if you know your Part B is starting and you have A, you want to talk to someone like myself, a couple of months, 2-3 months before you're going to turn 65, and we can go onto the computer and look at your drugs and make sure you're in a drug plan. In Monmouth County, there's 29 different drug plans, and for people that were enrolled last year, the first week of October, they're going to get it in the mail. It's going to say, this is the difference between your plan from this year to last year.
Oh, okay. But see, now that's really crazy because the guest we had that talked about HIPAA, talked about the privacy of what people are taking, and yet here you're getting solicitations about people who know what drugs they have.
Well, no, that's from the company that they have now.
Oh, the company that they have now.
Right, so if you have AARP, they're saying, okay, listen, your premium last year was $50 a month. This year it's going to be $60, but you're taking, and this isn't correct, but they could say, listen, you're taking Crestor. We're not going to cover Crestor next year. So you really have to pay attention to those because they might drop a drug that's very important to you when you have to find a new drug.
So most of your client interaction is done at their home, or some of it's at your office?
No, most of it is all done at their home. I do a number of speaking engagements at IHOPs and diners and senior buildings. I will meet people at the diner, but 90% is basically sitting down at the kitchen table. If I get to see, my wife was born in Sicily, so I have a lot of Italian clients, and they all give me espresso, and we have a good time.
Did you learn any Italian just to get by a little bit if your wife's not around?
I capisce.
Capisco, no capisco. So you find it something that's really rewarding?
Absolutely. I felt like I was meant for the business. Some other things I've coached for 19 years children and adults with disabilities in sports. We're working now. I'm president of the On My Own Foundation. We want to get affordable housing for people with disabilities.
That's a great organization.
And
I'm glad you mentioned it. I'll tell you why, Bob, because there's always life to then your daily life, that you have more to do. And I want to thank you for being on here, and thank you for watching us on Scan's Career Corner.